Hi, I'm Julie with Pumpware and today's Diabetes Tidbit, which is about shadowing. So let me tell you what's been going on. My daughter Nikki did cheerleading camp last year, and I didn't go. She was like an hour away, and of course, it's very strenuous to do cheerleading, and we had all kinds of issues that night because she obviously went low, and then they combated that with doubling up on the drink boxes and things. So through the night she was really high, and I had contact. I had great people helping. She was with 3 other moms that are absolutely wonderful. They helped us through the night, but they were up all night really testing her blood sugars and getting her back on track. So it was kind of very difficult, to say the least. And guess what? She wants to go to cheer competition camp again this year, and I think this is like a level up from where she was at last year, so I think there's going to be even more strenuous exercise and much more tumbling and much more of the acrobats that go with cheer. So I've spoken to the camp. First of all, there's no nurse. They have medics that are there, and if I want to go, I can pay to actually have a spot there and stay with her. Obviously she doesn't want me to do that, and I really don't want to go and have to do that either. So I'm kind of at a loss. All right, what do you do? Because she doesn't really want me there, but they don't really have a nurse there. And the medics I'm going to be talking and giving instruction to, but as you can imagine, there's going to be quite a bit of monitoring that you're going to have to do. And she's getting really kind of good with, making sure that she's testing and doing what she needs to do, but, at night it can become very difficult, and we're just not really sure. So what do we do? So I've kind of come up with a plan that I'm going to try, and I'll let you know how this all works out. And it's called shadowing. And really what it is the camp is 3 hours away. If something goes on where she needs me, or the camp needs me, 3 hours is quite a distance to be able to get to in that instance. So I have an opportunity to actually be around that area. I have some other business things that I have to take care of in that area, so I'm going to actually kind of shadow her. I'll drop her off at camp, and I'm going to actually stay in the vicinity for the time that she is physically at camp. And I've cleared it with the camp that I have the ability to come in at night if there is an instance where her blood sugars are all out of whack. I will be allowed to come into the camp and test her throughout the night or whatever. I'm not going to be there all day. I'm not going to be doing anything other than being a shadow to her if she needs me. And I've done that because first of all, I want her to be safe. Second of all, I want the camp and the people at the camp to feel comfortable with her. And, thirdly, I really feel after last year's camp experience that, somebody who really knows about type 1 diabetes needs to be around or be accessible to the camp. So that's what I'm going to do this year, is I'm going to try to be a shadow. So this is Julie from Pumpware, and I'll keep you posted.